Hi, this is Dr. Chumble. Let's talk about mommy makeover procedures. So mommy makeover procedures are a combination, and that combination can depend on what exactly your goals are. Usually this combination includes a breast procedure and an abdominal procedure. The breast procedure tends to be a breast lift with either an augmentation, making them larger, or a reduction, making them smaller. The belly procedure usually includes a tummy tuck or abdominoplasty, combined with liposuction, and sometimes you can use short scar abdominoplasty techniques in some cases. One important part of a mommy makeover, especially during the tummy tuck portion, will be to repair the rectus diastase. What does that mean? So during pregnancy, when the belly expands, the rectus muscles, your ab muscles, will split. In a lot of cases, when you're not pregnant anymore, the muscles don't completely come back all the way together to their anatomic position. So that can be corrected during the tummy tuck portion of a mommy makeover. Post-pregnancy bodies are beautiful already. However, they've gone through a lot of changes, and that can sometimes result in a hit to the self-esteem. In order to rejuvenate that body post-pregnancy, breast procedures and tummy procedures are very commonly done together at the same time in one sitting. So people often ask, is it easier to recover from getting both the breast and tummy procedure done in one sitting, or should they be better separated into two different surgeries? Well, that depends on who you ask. For many people, they want to do it in one sitting so that 6 weeks later, they can return back to work and not worry about having to get a second set of procedures. In those cases, yes, it tends to be better to do it in one procedure if it's safe to do, depending on health status. For other folks, they don't want to have to take care of two separate surgical sites. So in those cases, it is totally also acceptable to separate the breast and tummy procedures into two different surgeries, depending on what each individual's goals are. It is really important to be nicotine-free for 6 weeks before and 6 weeks after your mommy makeover procedure in order to help your incisions get the blood flow and the healing nutrients that they need. Folks often ask, when can I start working out after a mommy makeover procedure? The answer is usually 6 weeks depending on what combination of procedures you ended up having. So if you had a breast lift and a tummy tuck, it would be the full 6 weeks. If you had liposuction alone with a small breast lift, it could be shorter than that. So it really depends on what exactly you had done. So who gets a mommy makeover? It's really important to remember that your body is very likely beautiful as it is after your pregnancy. However, if your self-esteem has taken a bit of a hit post-pregnancy with all the changes your body has been through, rejuvenation is available for that, and we are happy to help.